Hello, my name is Tamara Honhorst. I'm a registered nurse as well as a total joint clinic educator here at the Institute for Orthopedic Surgery. We have provided videos for your corresponding total joint replacement that include anesthesia, blocks, and occupational and physical therapy that I would recommend watching those prior to watching this video. The first thing that I'm going to talk about is go over some more information and provide you with a little bit more depth on what to expect when you come in for your anesthesia plan as well as your blocks. Once you come in for your surgery, we're going to get you registered. We're going to take you back to the pre-op area. That's where everything's going to take place for you as far as getting you prepped, prepared, and ready for your upcoming surgery. We're going to get you dressed for surgery. We're going to get an IV started. We are going to do a small health assessment. And it's going to be a very busy time. You're going to meet all kinds of people. You're going to have a pre-op nurse, you'll have a surgery nurse, you're going to have nurses that help do the blocks, anesthesia team is going to meet with you, and your surgeon's going to come in and sign the leg that you're going to do surgery on. The preoperative area is also the same location that the blocks are going to be performed in, as well as your spinal anesthetic. Once we get your IV started, they're going to give you some sedation through that IV. This is going to help you settle and relax to get ready for those blocks. Once the anesthesia team has provided you with these blocks, they're also going to start your anesthesia at this time as well, which is the spinal anesthetic that the previous video had talked about. You got to keep in mind, these blocks do not make your leg numb, they don't make your foot numb, they don't affect your mobility in any way. They just kind of numb up the nerves around the surgical site to help with that initial postoperative pain. Generally, they last for 24 hours after surgery. Some patients say a little less, some patients say a little bit more. Now, most patients after a block say that their leg just feels heavy after surgery. With a total knee replacement, sometimes they say the top of the knee might feel a little bit numb as well. And then you will still be able to walk on it, you can move your legs and things like that. Once the spinal sets in, that is where your numbness is going to take place. You are generally numb from about the belly button down, so mid-waist down. I know at times the blocks as well as the anesthetic can sound a little bit scary, but there are many benefits to receiving a spinal block versus a general anesthesia. One of the many benefits is that most patients wake up pretty alert. You can eat and drink right away. Most patients experience no nausea or vomiting after surgery, and there's no need to put a tube in your airway and hook you up to a breathing machine and give you a bunch of general anesthesia medicine. These medicines can cause potential complications after surgery. They can increase your risk for nausea and vomiting after surgery, and it just takes some time to get those medications out of your system. If we use less medication during your procedure, that's going to benefit you after surgery. We can always give you additional pain medicines if needed. After a spinal anesthetic, most of you will come into the recovery room still numb from about the belly button down. As far as how long that lasts, that's a little bit different across the board for everybody. Sometimes patients can come to recovery right away and move their legs initially. Some people it takes 15 minutes, sometimes it could be 35 minutes. Sometimes you can have residual numbness on the bottoms of your feet for up to an hour. But this will all resolve in time and you will get all of your sensation back. One of the most common side effects after a spinal anesthetic is that you are completely numb from the belly button down. That includes everything in that region, including your bottom. We usually don't use catheters here at the Institute for Orthopedic Surgery. It's just another risk for infection. You're not in surgery all that long to warrant one, and most patients don't want them. When you wake up, you will wake up with a pad underneath you. You get lots of IV fluids during surgery, and when you're numb in that region, you can't tell if you have to urinate or not. It just kind of happens. We would never let you know if you did. We just clean it up and move on. But once we do get you up for the first time when you're in your room, we do have you wear some disposable pull-up underwear because your bottom is kind of the last thing to wake up from this procedure. At this point, you will have the sensation that you have to go to the bathroom, but you may have the inability to control it all the way. This will eventually resolve in a few hours, and then you can go back to your normal clothing. Now that we've talked about your anesthesia, your nerve blocks, and your surgeries all over, let's get you up and get you moving and start your physical therapy. So some of the things that I like to talk about with physical therapy include starting your exercises as soon as possible. You got to remember that prior to surgery, the knee or the hip that we're going to be operating on is a little bit weak, it's deconditioned, and it might not be as strong. Doing the exercises prior to your surgery do make a difference in your recovery. It's going to give you a little bit of strength and endurance, and it'll allow you to do your therapy better and more effectively after surgery. So the more that you do before surgery, the better off you are after surgery. With physical therapy, the key component to your recovery is keeping up with therapy. Whether you're having a traditional knee or a Jiffy knee, the physical therapy protocol initially is all the same. Normally, it's about 3 times a week for 6 weeks. What we are seeing overall is that patients that get a Jiffy Knee a lot of times require less time in therapy. They have quicker healing time, they are driving faster, they can get rid of their walker quicker, they have less pain sometimes associated with that. But at the same time, you still are required to do therapy. A Jiffy Knee is still a knee replacement. It's not a quick fix. You do have to put the work in, and you do have to put in the time. You're only get out of these surgeries what you're going to put into it. And so keep in mind that even though you're getting a Jiffy Knee replacement, you still are required to complete your physical therapy. If you're having a hip replacement, sometimes your physician will not require you to complete outpatient therapy. You're just going to be doing the exercises at home instructed by your therapist prior to discharge. At your follow-up appointments, if they feel that you need some physical therapy, they might initiate therapy at that time. Initially, everybody is going to need a walker, whether you're having a hip replacement or a knee replacement. Either a Jiffy or a traditional, you need to have a walker. Most patients can get by with a wheeled walker. However, we only want a max of 2 wheels. We will not use a 4-wheeled walker, so don't bring that into the facility. Also, Medicare and most insurances will pay for 1 walker every 5 years if you haven't purchased one through them. If you feel like you need a script or an order for that, please reach out to your surgeon's office and they can provide that for you. You can also look at thrift stores. Some organizations such as churches, VFWs, Council on Aging, they also have equipment that is available for borrowing or renting. Some of our patients go home the same day after surgery, some patients stay overnight, and some patients have a 3-day stay. Depending on what you need and what your insurance requires, we'll provide you with physical therapy prior to discharge. Normally, if you go home the same day, physical therapy is usually scheduled between the hours of 2 and 4 in the afternoon. As long as you meet all the requirements for discharge, we'll get you going usually around supper time. For everybody else that stays overnight, physical therapy normally is on the floor between 7 and 8 in the morning. And then if you do have to stay more than 1 day, physical therapy themselves only comes to your room once a day. However, you're going to be doing those exercises that they instruct you to do throughout the day. You're going to be up and down for meals, to the bathroom, and the nursing staff will have you in the hallway a few more times throughout the day. So even though physical therapy themselves only comes once a day, you're still getting lots of activity and movement throughout the day. Whatever day you're going to be discharged on, we will do stair training. So look around your house, make sure you know which entryway you're going to come into, make sure you know how many stairs there are they wide, are they narrow, do they have a handrail, what side is the handrail on? These are all questions that your physical therapist is going to ask, and based on your situation and scenario at home, they're going to give you all tips and tricks of the trade to make sure that you get into the home successfully. If you have a space that you're worried about or concerned about, in the medical field, we're visual people, so if you snap a picture of your stairs or entryway and show that to your therapist, we can provide you with the education and information needed to get into the home safely. We have a set of stairs here that you will need to demonstrate that you can go up and down safely in an effective way based on the information and the techniques provided by your physical therapist. This will ensure us that we know that you can get into your home safely at discharge. Prior to your total joint replacement, you are required to complete some preoperative testing. This could include EKG, chest x-ray, a urine specimen to rule out a urinary tract infection. We do swab the inside of your nose for the staph infection MRSA, and we get some blood work. Each physician has their own protocol that they may have you do. We also have to meet the anesthesia requirements as well. All of our joint replacements do have to have a medical clearance. This is just going to ensure that you're at your healthiest, you're at your best to endure the procedure. Some of you may have to see more than one physician. Some of you may have to meet with your medical provider as well as your cardiologist or your lung doctor or your kidney doctor. Keep in mind that some of you may also have to complete additional testing once your test results have been received. It could be that the day that they drew your labs, your potassium could be on the low side. Your physician may want to check that and see if it's higher and in normal range. Or it could be that they found an abnormal EKG and they may want to look at that a little further. That would include an ultrasound of the heart or a stress test or something like that. So keep in mind that there could be additional components to your preoperative testing that would need to be completed before your physician is willing to sign off on you. Again, we cannot proceed with your total joint replacement without a medical clearance, so you must keep these appointments. Approximately 5 to 7 days prior to your total joint replacement, you will receive a call from the pre-admission testing department. We will do a complete health assessment on you that is a requirement for anesthesia. We are also going to go over a bunch of reminder things that you've heard on the video today, as well as give you your pre-op instructions. That is going to include your arrival time. Normally you have to be here 2.5 hours prior to your surgery. The exception to that is if you're the first case of the day with a 7 or 7:30 start time. The earliest we bring any of our patients in is 5:10 in the morning, so that would be the earliest. Otherwise, you are going to be here 2.5 hours prior to surgery. With that, there is no food allowed for 12 hours. So that's from your surgery time, not your arrival time. So if your surgery is at 7 a.m., no food after 7 p.m. However, you are permitted to have plain water, any flavored Gatorade, Powerade, Propel, any kind of electrolyte drink all the way up until the time that you leave the house. Also, prior to leaving your home for your surgery, we do encourage that you drink 2 to 3 8-ounce glasses of water. That's going to ensure that you're nice and hydrated when you come in. That's going to make your IV insertion go better. It helps you perform better overall during and after surgery. Once you're in the vehicle to get here, that's your cutoff point. Don't chew gum, have a mint, or anything else by mouth at that time. Also, a few days prior to your surgery, we do encourage you to increase your fluid intake to about 90 to 120 ounces a day. Again, this is going to ensure that you're nice and hydrated for your procedure. If you smoke, vape, use any nicotine pouches, any other kind of tobacco products, we do ask that you abstain from that on the day of surgery. Any kind of marijuana use, even if it's just gummies to help you sleep at night, we have you abstain from that for 48 hours prior to your surgery. So on the day of surgery, we would like you to shower with a liquid antibacterial soap. You're just going to take a full body shower as you normally would. Rinse everything off. Once that is complete, you are going to be provided with a sponge. This is what the package is going to look like. This is going to get some extra bacteria off of your skin prior to your procedure. So once you have taken your shower, you've rinsed everything off, you're going to open up your sponge. This is what it's going to look like when you open it. This little blue piece here is for fingernails. You're not going to do anything with this piece, so you can just put it to the side. Also, your sponge will look a little bit different than what I have here for demonstration purposes, because your sponge will have some soap on there, so it'll have a soapy solution. It kind of has an orange cast to it, and that's what it's supposed to look like. We also just want you to use the soft spongy side. Don't use the side with bristles, okay? Once you're in the shower and you've done your shower, rinsed everything off, you've opened this up, you're going to give this a good couple of squeezes. It's going to get nice and sudsy and foamy in the shower. If you're having a knee replacement, you're going to start at the knee, clean in a circular motion all the way around the knee, sing happy birthday a couple of times. That's just a good enough amount of time to kind of spend in that area. Once that area is complete, you're going to migrate up to the groin area. You're going to do the same thing. Clean the groin area really, really good. Sing happy birthday a couple of times. At that point, you're going to clean the whole leg that we're going to do surgery on. Let it sit there a minute or two, and then you're going to rinse it off. If you're having a hip replacement, you're going to do the same thing. Obviously, you're going to start at the hip. So clean the hip area really, really good. Sing happy birthday a couple of times. Clean that groin area really good. Do the whole leg that we're going to do surgery on. Let it sit there a minute or two and rinse it off. This is a one-time use, so this is a one and done thing. Once you've used it, you're just going to toss it to the side. And that's what we would want you to do prior to coming in for your surgery. For the ladies, we do ask that you don't shave that surgery side for approximately 3 to 5 days prior to surgery. We just don't want any potential cuts, sores, nicks, or scabs, areas that could potentially be a source for infection after surgery. For the men, if you have a hairier knee or leg, don't worry about that. We have special razors and clippers that the surgeon will use in the back to remove any body hair prior to surgery if they request that. Also, on the day of surgery, we don't want you to wear any kind of creams, ointments, salves, powders, lotions, makeup, nothing on your skin. Deodorant's about the only thing that we want you to wear in that day. Any jewelry or piercings do need to be removed prior to surgery. Also, for the ladies, when we talk about fingernails, that's always a question that people have, is what kind of fingernail polish, if any, that they can have. As long as it's a lighter shade, not a deep dark blue, purple, black, anything like that, more like a French tip or a clear polish, that is going to be perfectly fine and permitted for you to wear in for your surgery. Next topic of information, we're going to be discussing your medications, what to take, what to stop, and what to do with your medications. When we call you within that 5 to 7 day range prior to your surgery, we're going to go over this in more detail, but this is just going to be some quick information so you know what to do with your medications. You will be provided a medication list, and this is going to have all of the instructions on what to take, what to hold, when to do these things as well. But things that we do have you hold a full 7 days prior to surgery is going to be anything that's an anti-inflammatory. That includes products like Aleve, Motrin, ibuprofen, naproxen, Mobic, Celebrex. Again, anything that's an anti-inflammatory. Most patients think that those things don't help them, but once we take those away, we do notice that you do have increased aches and pains, so those products do keep things at bay, even if it's just a minimum. You can continue to take Tylenol-based products, so Tylenol Extra Strength, Tylenol Arthritis, and things like that, all the way up until the night of surgery. On surgery day, we don't want you to take any of those items on surgery day. The other things that we're going to have you hold for a full week prior to surgery is going to be anything that's a vitamin, supplement, or herbal medication. These things include from a routine multivitamin to like cinnamon, turmeric, fish oil, glucosamine chondroitin, vitamin B, C, D, zinc. Anything that is a vitamin or supplement, we do have you hold those for a full week prior to surgery. If anybody takes a GLP-1 medication, that's going to include semaglutide, trizipatide, Zepbound, Mounjaro, Wegovy, Ozempic. Any of those things for weight loss or for your diabetic management, those have to be held a week prior to surgery. If you are diabetic and you take a medication called metformin or glucophage, we have you hold that for 2 days prior to surgery. If you are diabetic and you take a medication called Varziga or Jardiance, that is a 3-day hold. You're going to hold that for 3 days prior to surgery. If anybody takes a blood thinning agent, that includes aspirin, Xarelto, Effia, Brilinta, Eliquis, Coumadin. The instructions for stopping those medications need to come from the prescribing physician, whether it's your cardiologist because you take a blood thinner because you have a heart stent or you have a history of blood clots and your family physician prescribes that for you. As your surgeon here at the Institute for Orthopedic Surgery and us as nurses, we are not permitted to tell you when to stop that. That does need to come from the prescribing physician, even if you just take an aspirin. The instructions may include only a 2-day hold. Sometimes they'll tell you 3 days, sometimes they'll tell you 5 days. Just go off of their direction. If you are not going to see them prior to surgery, make sure that you reach out to that office and get the full instructions prior to stopping that medication. Please don't stop these abruptly or anything of that nature. These are very important medications and the instructions need to come from the prescribing physicians. Next, I'm going to talk about what to take on the day of surgery. The only medications that we want you to take on surgery day are going to include any kind of heart medication, seizure medication, thyroid medication, any respiratory medications if you use an inhaler. There are also going to be some blood pressure medications that you are going to take as well. When we call you, we are going to review which blood pressure medications to take because there are certain ones that we don't want you to take on the day of surgery. While you're here, we do utilize your own medications. So we want you to bring your prescription medicines with you in their original bottles, just as you would have purchased them from the pharmacy. Please don't bring any of your vitamins, supplements, or herbal medications, or any controlled substance, as we have to utilize what we have here. Again, when we call you with your preoperative instructions, we will remind you what medications to take, what to hold, and what to do with your medications. So on the day of surgery, when you arrive here at the Institute for Orthopedic Surgery, you're going to come to the entrance with a green number 2 located on the outside of the building that says hospital. As soon as you come through the doors, you'll see the registration desk. That's where you're going to sign in and they're going to get you registered and everything for surgery. At this time, we want you to bring in everything with you. Everything is going to include your medications, your walker, your overnight bag, insurance card, photo ID. If you have a CPAP machine, please bring that with you. We'll actually use that in surgery. Don't bring any water. We will supply the sterile distilled water for you while you're here. We will label everything and we will have it for you when you get to your room. Once you get registered, they're going to put an ID band on you for identification purposes. They're also going to put a small tracker on you, and that's going to be for your families. I promise we're not going to lose you here in the facility. Your family will be able to follow where you are in the process of things. There's a TV monitor located in the lobby. They'll be able to see what time you went to pre-op, what time you got to surgery, what time you got to recovery. While you're in surgery, your family members will receive updated text messages with surgery has started, surgery's almost over, as well as instructions to go to the front desk to meet with a physician. Once surgery is finished, your surgeon is going to be talking to your family. From that point, it's probably going to be about an hour and a half or so before you're kind of reconnected with your family, because once the surgeon is finished, it doesn't necessarily mean you're out of surgery yet. You're getting your wound closed up, you're getting woke up from surgery, recovery is about an hour, and then once you get to the floor, the nurses are going to get you all checked in and settled prior to getting your family. Once the surgeon has talked to your family, if they would like to, we have a small waiting area upstairs. There is elevator access behind the big set of stairs in the lobby that they can access if they need to. This is the location that your nurse is going to come out and look for your family, as all of our rooms are upstairs. We have 24 patient suites. They're all private. They have their phone, TV, bathroom, anything that you might need in your room while you're here. Once you get to your room, this will be where you are until you're discharged. At that time, your family is more than welcome to come and sit with you and visit with you. We do not have any kind of age restrictions or anything like that. Normally our visiting hours are 9 a.m. to 9 p.m. However, if somebody is here prior to opening hours or after closing hours, there is a small box on the outside of the door at the green entrance number 2 that you can press, and the staff here at the Institute for Orthopedic Surgery can communicate with the person outside and allow them access and gain entry to the facility. During your stay here at the Institute for Orthopedic Surgery, we do have a full dietary kitchen and staff for our patients. We do not have a cafeteria, so your families are more than welcome to bring something, go get something, have something delivered, or something of that nature. We do have a small vending area available. We do have free coffee and tea in the lobby. However, it's very limited, so please make sure that your family is aware of this and plans accordingly. Some things that you might need during your stay here at the Institute for Orthopedic Surgery: we encourage loose-fitting, comfortable clothes, things that's not going to be real tight or restrictive. Whether you're having a knee replacement or a hip replacement, I do recommend elastic waisted pants, things that you don't have to button or zip or anything of that nature. For a knee replacement, we do need to be able to visualize your knee at times, so make sure if you're wearing pants that they are baggy enough and stretchy enough to go over your knee. It could be sweatpants, pajama pants, anything that you're going to be comfortable in. Also, our temperature here can be variable, so please plan that accordingly as well. Each day that you're here, we do get you cleaned up and dressed for the day, so bring anything that you're going to need: toothbrush, toothpaste, deodorant, any kind of personal hygiene items that you might need. If you wear glasses, contacts, dentures, or hearing aids, these are items that cannot be worn back in surgery, so please make sure that you bring a case to store those items in. Once you're back in your room, within a few hours after surgery, we're going to get you up and moving. There's no rest for the weary here at the Institute for Orthopedic Surgery. Obviously, you have to have a good leg to stand on, so we're going to let that numbness wear off from your spinal anesthetic prior to getting you up. While you're here, you are our responsibility. Under any circumstance, we don't ever want you to get up without assistance. Always use your call light. We still have patients that don't like to follow the rules, so sadly, all of our chairs and beds do have alarms on them, so there's no route for escape. It's just easier to use your call light. The nursing unit is fully staffed with nurses and techs. The nurse-patient ratio is normally 3 to 1. A lot of times that's less than that, so you do get individualized nursing care while you're here at the Institute for Orthopedic Surgery. Always use your call light, even in the restroom. Keep in mind that we are medical providers. We're here to help you and assist you. We don't want any injuries that could prolong your stay after surgery. We understand that most of you will go home the next day. Some of you will even go home that evening after surgery. However, while you're here, you're our responsibility. You could get dizzy, lightheaded, you could trip over something. Anything could happen, and that could cause injury, and we just want you to be safe while you're here. Once you're ready for discharge, the only physical prescription that you're going to have at discharge is going to be for physical therapy. When we talk about physical therapy, we do want you to go ahead and make your appointment prior to your surgery date. This is going to be better and more beneficial for you because you can make sure that the location that you prefer is in your network. You can get a time frame that works with you and your driver, and it's all about planning and preparation. There's no big surprises when therapy is going to be. You're already going to know where that's going to be located. If for any reason you are wanting home health or a skilled nursing facility, we do have discharge planning nurses that help take care of all of those needs. So prior to your surgery, you will receive a call from our discharge planning nurses. At that time, you can let them know what your discharge plan is, and they can help arrange that. You will also be on some type of pain medication. All of these prescriptions will be submitted to your pharmacy electronically. Once they are available for pickup, keep in mind anything that you do pick up prior to surgery is for at discharge. Don't take them before surgery, and don't bring them here to the hospital. Anything that is a narcotic will not have an effective pickup date until the date of surgery. So you cannot pick up your narcotics the night before, 2 days before, or anything like that. Also, with narcotics, we are governed by the state of Ohio on a few stipulations on how we can write for narcotics. These are not our guidelines, these are coming directly from the state of Ohio. For our facility here at the Institute for Orthopedic Surgery, we can only write enough pain medicine to last 1 week. So if you take more than that's prescribed or more frequently, your pain meds are going to run out, and legally our hands are tied. The other stipulation that we have is that we cannot write for, say, 42 tablets with 2 refills, meaning that we can't write for automatic refills. That does not mean that you cannot get a refill. It means that it's not going to be automatic and that you do need to call in and request that. This part is our policy. If it's after hours or on the weekend, the on-call physician will not prescribe any additional narcotics. You just need to call through the week during normal business hours and give at least a 2 days notice. That way they have enough time to get that medication sent into your pharmacy. If you don't call for it and ask for it, you're not going to get it. After a total joint replacement, you are at increased risk for blood clot formation. That is one reason that we start your blood thinners the night of surgery, to minimize the risk and the complications of having a blood clot. If you already take something like Xarelto, Effient, Brilinta, Eliquis, we will resume those medications. Otherwise, normally our physicians use aspirin. At discharge, you will be instructed on how many times a day and for how long to take that blood thinner. A few additional things that we do to ensure that we minimize your risk for blood clot formation is we provide you with some compression stockings. If these are ordered by your physician, when you come in for surgery, we have you put this on your non-surgery leg. By the time that you get to your room or shortly after, we will apply the other one to your surgery leg. Normally, you can wear these throughout the day and take these off at night and wash and line dry them. And then you will be instructed on how long you have to wear them. Normally, you wear these 2 weeks on the non-surgery leg, 4 weeks on the surgery leg. These do help promote circulation, they help prevent blood clots, and they do help with swelling. Very important, we do want you to keep up with your TED hose or your compressions. Another thing that we do to help minimize the risk for blood clot formation is we use sequential compression devices or SCD sleeves. If these are ordered by your physician, you will wake up with these on. These just wrap below the knee onto the calf. It has a small bladder on the inside and it wraps around the leg in this motion here. This then hooks up to a machine and these inflate and deflate every so often. So they rotate. One will be inflated, one will be deflated. This just helps massage the legs to keep the blood flowing to help, again, minimize the risk for blood clot formation. These are only worn while you are here. You will not be going home with these on. The idea at home is you're doing your exercises, you're up walking, taking your blood thinners, and wearing your compression stockings. So these are only worn while you're here at the Institute for Orthopedic Surgery. After surgery, we also like nice, healthy lungs. This is called an incentive spirometer. All of our patients here at the Institute for Orthopedic Surgery receives one of these. This is a tool to help expand your lungs, makes you cough, get some good air exchange in there, and cough up any congestion or anything that you may have so it doesn't settle in your lungs and harbor any bacteria and cause some lung infections. The way that this works is you put this piece in your mouth. Most patients think that you blow into this, but you're actually going to suck on this like you're drinking a milkshake. The key to this is a slow, deep breath in. When you do that, this piece here will rise up. Based on where you can get it and things like that, we'll set a little bit of a goal for you. I will be honest and say that most patients hate to do this, so when they do this, they act like they're having a baby and they just go like this, really super fast. Well, if you've ever used one of these, you're gonna feel like you're gonna hyperventilate. Also, it's not doing you any good. So, to keep you on task of doing it correctly, there is this little tool on the side of the device to help navigate you to keep you doing it correctly. Almost guaranteed, the first time that you take a big deep breath in, this little piece is going to rise all the way to the top and you think, man, I'm really good at this. I have mastered this device. In actuality, if you notice, there are 2 arrows here on the device. We would like this blue chip in between those 2 arrows. This is ensuring that you're using it properly and maintaining that slow, deep breath. The goal of this, again, is to get those lungs expanded, get some good quality air exchange in there, and it is made to make you cough and get rid of any kind of secretions that you may have. After a total joint replacement, along with blood clot prevention, the other main factor that we try to avoid are infections. Within 30 minutes of incision time, you will receive an antibiotic through your IV. If you are going to be discharged on the same day after surgery, you will receive 1 additional dose prior to discharge. Otherwise, when you stay overnight, you get 2 additional doses through your IV. Normally, we don't send our patients home on oral antibiotics because you're receiving those 2 to 3 IV doses prior to discharge. But at home, we do want you to monitor your symptoms for any kind of potential infection. That could be a fever over 101.5, any kind of redness, streaks down the legs, increased warmth, pain, swelling, anything that you don't think is right. Please do not hesitate to reach out to your physician. Try not to touch or scratch your incision. Keep any pets away from your incision. Frequent hand washing. Avoid people who are sick. These are all key components in keeping you healthy and infection-free after surgery. After your total joint replacement here at the Institute for Orthopedic Surgery, your wound will be covered with a dressing. If you are having a total knee replacement, you will have an occlusive dressing that will stay in place for a designated amount of time. It'll be waterproof and you will be able to shower with it. At discharge, you will have specific instructions on when and if to remove it prior to your first post-op appointment. For hip replacements, you will also have a dressing covering your wound. Some physicians choose to use an occlusive dressing that will stay in place for a designated amount of time. It will also be waterproof and you can shower with it, while other physicians require you to do a daily dressing change. At discharge, you will be informed on whether or not you need to pick up some dressing supplies for a dressing change at home. After a joint replacement, you do need to wait a period of 3 months before you get your next dental cleaning. Also, you do need to let your dentist know that you've recently had a joint replacement. You do need to be on some antibiotics. Normally how this works is you take about 2 to 3 tablets about a half hour to an hour prior to your next dental cleaning. The reason for this is your mouth is full of bacteria. You could get a cut in the gum lines, the bacteria could get into the bloodstream, and the first place it's going to want to migrate to is that new knee or hip. If your dentist is saying that it's not needed, it's not necessary, or they are unwilling to call this prescription in for you, please reach out to your surgeon as they are going to want you to have this antibiotic prior to your next dental cleaning. What's different among surgeons is the length of duration. Some physicians require you to do this for the first year, some say for 2 years, some say for life. The 3-month waiting period is just your routine dental cleaning. If you think that you have an issue or a concern, you broke a tooth, you think you have an infected tooth, something of that nature, please make sure that you're reaching out to your surgeon as well as your dentist and getting that taken care of as soon as possible. Upon discharge, you're going to need alternative methods for icing your extremity at home. This could include gel packs or different ice bags, or even a cold therapy unit. If you're uncertain what a cold therapy unit, it kind of looks like a cooler. You fill it half with ice, half with water. It hooks up to an outlet. It has a pad that circulates cold water through it, helping ice the knee or the hip area. You can research these things on your own and find something that works for you, but please plan ahead for some icing at home. Here at the Institute for Orthopedic Surgery, prior to any joint replacement, we do require that you have a MRSA screening done. This is a swab that we do inside the nasal cavity. It doesn't go up very far, just on the inside of the nose. We test to see if you're a carrier for the staph infection MRSA. If you test positive for the staph infection MRSA, it does not mean that you have an active infection. It just means that you're a carrier. After a total joint replacement, if you're a carrier for the staph infection MRSA, you are put at a higher risk for infection, because that MRSA that is laying dormant inside of your nose could become active, and the first place that it's going to want to migrate to is that new knee or hip. If you test positive for MRSA, it is not going to delay or cancel your surgery in any way. We would have you start a treatment. This treatment would include a body wash and a nasal ointment that you would apply inside your nose twice a day for 5 days. You would also use the body wash for 5 days. We would have you hold that for a certain amount of time, and then we would re-swab you prior to surgery. If you would test positive after your second screening, again, this is not going to delay or cancel your surgery. We would just have you resume the treatment that you were previously doing. While you're here, you would get an extra dose of antibiotics through your IV before surgery as well as after surgery. And while you're here, we would just put you in what we call contact isolation. That just means whoever enters your room would have to wear a gown and gloves. One of the many questions that we get after a joint replacement is about driving. You will be restricted on driving for a short amount of time after your surgery. Whether you're having a hip replacement or a knee replacement, if it's on the left side, normally you're at 2 to 3 weeks with restrictive driving. You have to be able to get in and out of the car by yourself, you have to be off pain medicine, and you have to be able to navigate that independently. If you're a right-sided procedure, total hip or total knee, that comes with a little bit longer driving restrictions. Your therapist will help you navigate this as well as your physician and let you know when it's safe enough for you to drive. After a joint replacement, whether it's a traditional knee replacement, a jiffy knee replacement, a lateral hip replacement, or a direct anterior hip replacement, everybody is going to need a walker. That is the only piece of required equipment for everyone. Some people find that they need additional adaptive equipment as well. This could include a long-handled shoe horn, a reacher or a grabber, a long-handled sponge to reach your lower body for bathing. Another piece of adaptive equipment could include a sock aid. This allows you to put on your socks easily if you have a hard time bending over or if you have restrictions, say from a hip replacement. They might need an elevated toilet seat. There are several different types available. One is a bedside commode. This is adjustable. It has armrests. You can even fit this over your toilet, or they have toilet risers that just kind of fit in the bowl of the toilet and screw in, elevating your toilet seat to an optimal height. Some other things that you might find useful is a tub bench or seat for your shower. That way you can sit in your shower safely if you feel like you don't have the endurance or the ability to stand during a shower. With the exception of the walker, most insurances and Medicare do not cover the additional pieces of adaptive equipment. However, you can find these online and they are fairly inexpensive. Total joint replacement is a joint effort and recovery is a process. We know and understand that you have many choices in your orthopedic care, and we thank you for choosing the Institute for Orthopedic Surgery.